Hi, this is a recorded lecture for the axial skeleton. My name is Dr. Alita Partosudarso, and I'll be walking you through those slides. So, as you know, we always start with a overview of the lecture. So what you can see here, because this is the first of two lectures on the skeleton, the second one is the appendicular skeleton. What I'm going to do is start off with an overview, looking at the divisions, and then looking at the three different components of the axial skeleton, which is the cranium, the vertebral column, and the thoracic cage. And then we're going to finish off with an overview of the embryonic development of the axial skeleton. We will go through this diagram in a bit, and this is something I just put in again just to remind you that directionality actually matters. And so if you can actually go through all the different directions, because we will refer to some of these terms as we go along in this lecture, as well as in future lectures. So, as you may know, there are 206 bones in the adult skeleton. Bones are dynamic organs which change in strength and thickness depending on the muscle strength or body weight. That means your bone can become thicker or thinner depending on what's going on, depending on the exercises that you do, depending on the diet, depending on the amount of calcium that is floating around in your system, depending on a lot of things. So it's each bone is a dynamic organ which can adapt depending on the situation. The structure of the skeletal system, you know that it forms the rigid internal framework of the body. It helps us to sit upright. It helps us to define our body shape somewhat. And the skeletal system is consisting of bones with cartilage that covers part of the bone, together with ligaments that bind bone to bone. In terms of the function, as I said, it helps to support the weight of the body. It helps to protect internal organs. So, for example, the brain is encased in the skull. The spinal cord is encased in your vertebra. Your heart and lungs are encased in the thoracic cage, and your pelvic organs are protected by the pelvis. 99% of calcium in the body is stored in bone. The bone also stores phosphate as well as fat. So fat is stored in yellow marrow, whereas the red marrow that you can see here in the diagram on the top houses the hematopoietic tissue, and the hematopoietic tissue is tissue that is found in the red bone marrow that helps to produce all sorts of blood cells, including red blood cells, white blood cells, and platelets. You can imagine if the skeletal system only consisted of bones, then we have no connection between bones and muscles, between bones to other bones, and all that kind of stuff. So there is cartilage, there is ligaments, and there are tendons. So let me get that sorted out. So cartilage helps to cushion the surfaces of the bone that connect with each other. So for example, if you have two bones that articulate, so this is the articulating site where they connect with each other, where they actually almost touch each other, what happens is there is a layer of hyaline cartilage on that bone, and there's another layer of hyaline cartilage in that bone. And so what happens is as the bone moves, whichever way it does, it means that you don't have bone on bone contact, which means that the ends of the bones are preserved. Another aspect of the skeletal system are ligaments. So ligaments are strong connective tissue that hold bones at a movable joint together. So you would have in this joint, you would have, I'm just going to erase that. On this joint, you would have a ligament that connects that bone to that bone, maybe over here, maybe another one over here. And what that means is it keeps the bone positioned together as they move around and do whatever range of motion that particular joint is able to do. And then because bones can't move on its own, they need to be moved largely by skeletal muscles. And so the connection between the bone and the skeletal muscle is called a tendon. So again, if you look at the joint, I'm going to erase some stuff. And say you have a skeletal muscle that is over here, right? What happens is the connection between the skeletal muscle and the bone is called the tendon, right? So tendons connect skeletal muscle to bones. Ligaments connect bone to bone. So this is a ligament that connects one bone to another. A tendon connects the skeletal muscle to the bone. And then where there is two or more bones that are articulating or connecting to each other, they have a layer of hyaline cartilage to actually soften, to actually prevent bone damage to the bones. In terms of the division of the skeletal system, it's divided into axial skeleton and the appendicular skeleton. So if you look at the diagram on the right, you can see that all the bones that are colored in beige are bones of the axial skeleton, whereas the bones that are colored in green are the bones of the appendicular skeleton. So we're going to talk about the axial skeleton in this lecture and then talk about the appendicular skeleton in the next lecture. And so if you look at the bones of the axial skeleton, basically what happens is it includes all bones that if you stick a rod right down the center of the skull, so all the bones around the central axis of the body is considered the axial skeleton. As you can see, the axial skeleton protects the brain, protects the spinal cord, and protects the heart and lungs. So the bones of the axial skeleton don't really move. They have a very much a protective feature. And you compare this to the bone of the appendicular skeleton, which are basically the bones of the upper limbs and lower limbs and their attachment to the axial skeleton. They're the ones that produce whole or partial body movement. So if you look at the appendicular skeleton, it includes bones of the upper limbs and the pectoral girdle, right, which is the clavicle and the shoulder bone, which then anchor them to the thoracic cage. And the bones of the upper limbs are very mobile. There's a wide range of motion to allow us to manipulate, carry, lift objects, or turn the head and trunk, right? Just move your shoulder in a circular motion. You've got a huge range of motion there. Bones of the lower limb and the pelvic girdle anchor them to the vertebral column, and the bones of the lower limbs are adapted for weight-bearing support and stability because they have to bear the weight of everything above them. If we're in the anatomical position, they provide stability and they provide whole body locomotion, right? Movement of the whole body, such as running, walking, jumping, jogging, and all that kind of stuff. And so we're going to talk more about that in the next lecture. Moving on, we're going to look at the three parts of the appendicular skeleton. So we're going to look at the cranium, followed by the vertebral column, followed by the thoracic cage. So the first one is the cranium or the skull. So the cranium or the skull includes the cranial vault, right? Cranial bones, as well as bones of the face or facial bones. Individual bones in the adult skull are fused together into one single unit. The only exception, the only movable bone in the entire cranium is your lower jaw or the mandible. Everything else is fused together. And if you look at the fusion line between any two bones in the skull, what you can see is it's got a suture, right? Suture is like a sewing stitch. And what you can see in the suture is that the suture line isn't straight. You can see that the suture line is a little bit jagged, right? A little bit crooked. And this jaggedness of the suture line actually provides strength of connection between the two bones. So you can see here, the suture right here isn't straight, isn't just a straight line. It sort of wiggles slightly all over the place. And that wiggly line actually helps to strengthen that suture line. So sutures are an example of an immovable fibrous joints. We're going to look at that when we go and look at the 2 lectures away, so the muscles and joints. And so you can see here their teeth-like projections interlock with each other, and these sutures are found only in the skull, right? They're a special feature of the bones of the skull, with the exception of the mandible. When we move along and look at the cranial bones, what we can see here is that there are 6 different kinds of bones that make up the brain case or the cranial vault. And a lot of the names of the bones are fairly self-explanatory. So the frontal bone is the bone right in front. So this is the frontal bone over here. It's right above your eyes. This is what it looks like. It forms your forehead. As I said, upper parts of the orbits of your eyes and anterior front part of the top of your cranium, right? So this is where understanding directional terms will actually help you. The next bone is the parietal bones. You've got a set right and left. So you look at the parietal bones. That is right behind the frontal bone over here. And so if you like lean back and put your hands on your head, more likely than not, your hands will be on your parietal bone. So that's what it looks like from the side. The third set of bones is the temporal bone. So if you look at where the temporal bone is located, it's located right where your ears are, right? So that's the temporal bone right over here. So it's the lower side of the cranium and the cranial floor. And the next bone is the ethmoid bone. What you can see here, the ethmoid bone is sort of behind the nasal bones, anterior in front of the sphenoid. So anterior is in front of, and it looks kind of odd. So if you look at the ethmoid bone over here, you can see that it's a complex, irregular shape, and it's found right behind the nose. The next bone is the sphenoid bone. I love saying the name. So the sphenoid bone is over here. You can barely see the sphenoid bone from the outside of the skull. And that's because most of the sphenoid bone, if you look at number 5, most of the sphenoid bone is found as the internal structure of the skull. So the only parts that are visible on the outside of the skull, are the sides. And what happens is it forms the central part of the cranial floor, right, where your cranium kind of ends in the floor. And you've got sphenoid sinuses as well, which we'll talk about later. If you look at the sphenoid bone, you can see that it makes connections with the frontal, parietal, occipital, and ethmoid bones. So it makes connection with all the bones, and you can see where it's located right here. I'm going to erase the slide. This is the sphenoid bone. So it connects with the frontal, right? The parietal, the temporal bone, and on the inside it connects with the ethmoid bone. So it basically holds all the bones together. And then the last bone is the occipital bone, which is right down at the back of the skull down below. So if you actually put your hair up in a low bun at the back of your head, then that's where you're putting it right on your occipital bone. If you look at the occipital bone diagram on the bottom, the right-hand side, you can see this is number 6 is the occipital bone. And what you can see is at the floor of the occipital bone, there is this huge hole. And this huge hole is called the foramen magnum, right? Magnum means huge, foramen means hole. So the occipital bone has a huge hole, and this is where the spinal cord goes through. Moving on from these cranial bones, we're going to talk a little bit about the facial bones. So the main facial bones are listed over here. So the first one is your lacrimal bones. So lacrimal refers to tears. So your lacrimal bone are where your tear ducts are located. And we all know that when we cry right from the corner of the eye that's closest to the nose. So that's where the lacrimal bones are located, right? So again, using your current knowledge to learn about anatomy and physiology. Nasal bones, as the name suggests, nasal refers to nose. So your nasal bones make up the upper part of your nose bridge. You can see it right over here and right over there. Your maxilla is your upper jaw. So it doesn't move, right? When you talk, you think that both upper and lower jaw moves, but it's actually the lower jaw that moves. The upper jaw just stands still, right? So the lower jaw is called the mandible. It's the only movable joint of the skull. It's the largest and strongest facial bone because it's the one that moves, and your jaw muscles are very, very strong. Next bone is number 5, the zygomatic bone. And zygomatic bone are your cheekbones. So, some people have a prominent zygomatic arch, and that's favorable in a lot of cultures where you can actually see the cheekbone. So that's what the cheekbone is. It's a zygomatic bone, and that arch is the forms the cheek. And then you've got the palatine bone. Palatine refers to palate, right? So the palatine bones forms the back part of the hard palate of your in your upper jaw. And then you've got the vomer bones, which are associated with your nasal septum, so the inner part of your nasal cavity. And then you've also got the inferior nasal conchae that forms the side walls of the nasal cavity, right? So that's the inferior nasal conchae here, right here, and these are the vomer bones. So again, out of this, this is about as much detail as you need to know with regards to what you need to know for this course. When we move on to the paranasal sinuses. So paranasal means next to the nose, right? And the sinuses are basically air-filled spaces which do two things. So they're hollow air-filled spaces, and what they do is they lighten the skull and they add resonance to the voice. This is why nobody really likes the sound of their own voice, because we hear it differently in our head to how other people actually hear it. And this resonance that the paranasal sinuses add to our voice is obviously altered when we have a cold or a sinus infection, because what happens with a cold or a sinus infection is that you've got mucus and excess fluid actually filling in the paranasal sinuses. So instead of your sinuses being air filled, they're going to be congested with mucus and fluid when we have a cold and sinus, and then it sounds like we're talking underwater kind of thing. 4 sets of sinus. Again, as the name suggests, the frontal sinus is located right in your frontal bone. Your maxillary sinus, it's all due to the name of the bone. So if you know the names of the bone, you know exactly where each of these sinuses are located, right? Frontal sinus, behind the frontal bone. Maxillary sinus, behind the upper jaw, the maxilla. Ethmoid air cells, again, connected to the ethmoid bone, and the sphenoid sinus are located within the sphenoid bone. So again, know the names of the bones, and then you know where the paranasal sinuses are. The hyoid bone is an interesting bone because it has no articulation. So the hyoid bone doesn't actually make a direct connection or a joint or an articulation with any other bone in the body. It's not part of the skull. So when you look at it, you've got the lower jaw right here, the mandible, and the hyoid bone is just located in the upper neck, right? So it's above the larynx, and it's just sitting over there. It's attached to the body with the help of small muscles. And the function of the hyoid bone is involved with the tongue, the larynx, the voice box, the pharynx, the throat during swallowing and speaking. So it helps with that. So that's the bones of the cranium, the skull. We're going to move to the bones of the vertebral column or the spinal column or the spine. It's referred to in a variety of ways. And what happens is that the bones of the vertebral column is composed of vertebrae, so that's the bone, separated by intervertebral discs, which are made out of the toughest type of cartilage. So they are made from fibrocartilage. If you look at the name intervertebral, inter means in between. So intervertebral discs are found in between each vertebrae. So if you have these vertebrae, so this would be C1, C2, C3, C4, C5. What happens is that the intervertebral discs are found in between these bones, right? And again, like cartilage found in other joints, they help to prevent bone-and-bone contact and damage. The vertebral column helps to support and move the head, neck, and body, and it also protects the spinal cord. So within each vertebrae, there is an opening, and that's where the spinal cord goes through. Okay. In terms of the region of the vertebral column, the vertebrae that's in the neck is called the cervical vertebrae. There's 7 of them, named from top down. So the topmost cervical vertebrae is called C1. The last cervical vertebrae is called C7, and then followed by 12 thoracic vertebrae. So again, T1 is at the top, T12 is down the bottom, followed by the lumbar vertebrae. L1 is the most superior out of the lumbar vertebrae. L5 is the most inferior. And then you've got the sacrum, which is fused as an adult. And then you've got the coccyx, or the tailbone, which is also fused as an adult. When you look over here, as increasing size of order, so what happens is cervical, the ones that are located at the top of the vertebral column, the cervical vertebrae are smaller than the thoracic vertebrae, and the thoracic vertebrae are smaller than the lumbar vertebrae due to the amount of weight off the body that they need to support. So when you think about it, the cervical vertebrae only has to support the head and neck. The thoracic vertebrae has to support the head and neck as well as the chest, which includes the heart and lungs and the esophagus. The lumbar vertebrae have to support the head and neck, the chest, as well as the organs that are in the abdominal cavity. And then the sacrum forms part of the pelvic girdle, and the coccyx is the tailbone. The thoracic vertebrae have attachment sites for ribs. So the thoracic vertebrae is what the ribs attach to, and we're going to look at that in the next slide. So when you look at the vertebral column, you can see that they're not straight. I mean, if you look at it from either the front or the back, it looks fairly straight. But if you have a lateral view from the side, you can see that it's not straight, right? It curves. So there are 4 different curves. Two of the curves exist from birth, right? 2 of the curves originate from fetal curvature. And so this is the thoracic curve right over there, as well as the curve that's formed by the sacrum as well as the coccyx. The other 2 curves, which is the cervical curve and the lumbar curve, develops as the child learns to sit and walk. So when you have an infant that doesn't move around, that can sit up, you might notice that the infant's back is just like this, right? Because the infant's back only has the thoracic curve as well as the sacrococcygeal curve, right? So the back of the infant looks like this. As the infant or the toddler learns to walk and stand, then the other 2 curves, the lumbar curve and the cervical curve, develops. Fun fact, the lumbar curve, which is this curve over here, is generally deeper in females because females are the one that are able to bear children. And so that deeper lumbar curve actually helps to support the weight of the developing embryo and fetus in the front. So that's just a fun fact. When we move to the structure of the vertebrae, so this is a typical vertebrae over here. What you can see is that it's organized into 4 different parts over here. So the body is this part over here. It supports the weight of the body, right? So what happens is that so if you look at the direction over here, anterior, posterior, right, left, what you can see is that the body is found in the front of the vertebrae, the anterior portion. And what happens is as it moves down the vertebral column, it gets bigger. So the vertebrae of a cervical vertebrae may be this big, and then the thoracic one might be this big, and then as it goes to the lumbar section, it gets even bigger because the lumbar vertebrae support more of the body weight. The other component of the vertebrae is the vertebral arch. So this is the vertebral arch over here, right? So it's in the back, the posterior section of the vertebrae, and it acts to protect the passage for the spinal cord. And then the third component is the hole or the foramen, and it's called the vertebral foramen because it's the hole in the vertebrae, and that's where the spinal cord goes through. You can also see that as part of the arch, you've got these processes, these parts that jut out, and I'm going to talk about that in a bit. And then the fourth component of the vertebrae is the intervertebral foramen. And this is the gap over here where if you stack the vertebrae on top of each other, there's a little gap. There's a little passageway over here, and that little passageway allows nerves that come out of the spinal cord. So the spinal cord will run all the way down here, right, in this vertebral foramen. And at each joint between subsequent vertebrae, there's going to be part of the spinal cord that emerges and leaves the spinal cord. And this part of the spinal cord that exits from the spinal cord is called the spinal nerve. And so it needs to exit safely somewhere so that it doesn't get pinched or trapped, because that can cause pain and loss of function. And so you've got this intervertebral foramen there. As I said, there are parts of the vertebrae that jut out, and those parts that jut out are called the processes. So you can see there are 7 processes. 3 of them are paired. So you've got 2 transverse processes, 2 superior articulate process, and 2 inferior articular process. All right. And what happens is all these processes are sites of connections with something else. So if you look at this, the transverse process, the transverse is the side, the transverse process attach muscles, or important muscle attachment, and those muscles help to move the vertebral column as well as to keep them stable. The spinous process is the one that juts out the back, right, the posterior end. So if you actually hunch over and you put your hand on your back, you might be able to feel your spinous process. Or if you ask someone in front of you to do that, you might be able to feel their spinous process, especially towards the top of the vertebral column. You've also got 2 superior articular process. So these are points of connection. So what happens is that the superior articular process of a vertebrae will connect with the inferior articular process with the next vertebrae up, right? So if you look at the diagram on the right hand side, you've got the inferior articular process over here, right? So this is, if I'm going to label the vertebrae, so vertebrae 1, 2, and 3. So if you look at the inferior articular process of vertebrae 2, what happens is they form a connection or a joint with the superior articular process of vertebrae 3. Similarly, the inferior articular process of vertebrae 1 will form a connection or a joint with the superior articular process of vertebrae 2. So let's just talk about it in terms of a ham sandwich. So you've got 2 pieces of bread over here, or a hamburger. Keep it kosher. Chicken burger then. Keep it very kosher. So you've got a bun and you've got the chicken burger over here. So each of the, and we're going to look at the top bread, right? So the bread, the upper bun here, this is the inferior, I'm just going to call it number 4. This is the inferior articular process of the bun on top. And this will touch over here the superior articular process of the chicken burger. If you look at the bottom of the chicken burger, what you can see here is that where it touches the top bun, at the lower bun, that's the inferior articular process of the chicken burger touching the superior articular process of the bottom bun. I hope this makes sense. Let's continue on. So I hope, like I said, I hope that makes sense. When we talk about intervertebral disc, again, inter means in between. So the intervertebral discs are located between vertebral bodies that are next to each other. So you can see here, this is the body of vertebrae 1. This is the body of vertebrae 2. And in between here, you've got the intervertebral disc. When you look at the intervertebral disc, it's made out of fibrocartilage, which is the thickest type of cartilage. And when you look at the fibrocartilage, it consists of 2 different layers. So you've got the outer layer, which is called the annulus fibrosus, tough, fibrous, circular outer layer. And then in the inside, you've got the nucleus pulposus, which is softer, gel-like material that helps to bear weight. So this is like a ball, right? A random ball, like I don't know, a baseball or a softball. On the outside is softer, on the inside, on the outside is a harder layer, the inside is softer. When we look at the thickness of the intervertebral discs, is very thin at the cervical layer, a little bit thicker in the thoracic layer, in the thoracic vertebrae, and then it's very thick when we get down to the lumbar vertebrae, right? So the function of the intervertebral disc, as it says, is to connect bodies of adjacent vertebrae, makes up about 25% of the height on the top of the pelvis, between the top of the pelvis and the base of the skull. And what happens as we age is that these intervertebral discs loses water, right? And you can see here the nucleus pulposus has a high water content. And so if you lose that water content, then what happens is the intervertebral discs become thinner, and then grandma shrinks. Not only does grandma shrink, grandma can't move from side to side or bend over as easy as a 20-year-old. And the other thing is, as the intervertebral disc gets thinner, what happens is there is a gap in between the bodies, the adjacent bodies, and then what happens is that the spinal nerve can actually be trapped and compressed and cause a lot of pain. The intervertebral disc can also shift or herniate and move to a location where it's not supposed to be. So it's not good getting old and having a herniated or ruptured discs. And we'll talk about that later as we progress through the course. So ligaments hold different bones together, bones that are next to each other. And because the vertebral column needs to be stable, there is quite a few different ligaments that hold the vertebral column together. So the first one is called the anterior longitudinal ligament. So just by its name, you know that it's located in the front, anterior. You know that it's long, so it goes from top to bottom, right, of the vertebral column. And the purpose of that is to prevent whiplash injury, right? Like if you were in a car accident, and to resist excess bending back of the vertebral column. So if you tip your head backwards, the reason why your head doesn't overextend is because you've got the anterior longitudinal ligament, and that helps to prevent weakness. The second ligament is the supraspinous ligament. Spinous refers to the spinous process, and so that's what the supraspinous ligament does. It connects spinous process to spinous process to spinous process on the back end, the posterior side of the vertebral column. And in the neck region, the spinous, supraspinous ligament is becomes the nuchal ligament, right? So the nuchal ligament is then an extension of the supraspinous ligament. And again, if you look at the location over here of the nuchal ligament, it helps to prevent your head from falling forward extensively. And then on the inside of the vertebral canal, you have two different ligaments called the posterior longitudinal ligaments, again, that are inside. And again, they run on the back of the vertebra, and then you've got the ligamentum flavum. And that, again, helps keep the vertebral column intact. So these four of five different ligaments help to prevent excess forward or backward bending motion, helps to keep the vertebrae stable, and helps to protect the spinal cord that's inside of the vertebrae. The next thing we're going to look at is we're going to look at the different features of the different vertebrae in the different locations. So we're going to start from the top and work our way down. So the first set of vertebrae at the top of the vertebral column is the cervical vertebrae. So what you have over here is you've got the typical features of the 7 cervical vertebrae, and then you've got unique features of the first cervical vertebrae, which is also called the atlas, and the second cervical vertebrae, which is also called the axis. But let's go through this. So in terms of a typical cervical vertebrae, you can see the body is quite small. You can see that the spinous process is bifid. So bi means two, so it's divided in two. So it's got a Y shape. You can see that the transverse process has a hole in it on both ends, and that allows vertebral arteries to go through, and the vertebral arteries supply the brain, right? So this is and then you can see that the vertebral foramen is actually quite large, because at this stage, right underneath the head, the spinal cord is quite thick. The C1, or the atlas vertebrae, is unique because it has no body. So you can see here, there's the body here of a typical cervical vertebrae. Atlas has no body, and the transverse process over here is longer and more lateral, so more to the side. It's got no spinous process at the back of it. And what happens is that you've got this anterior and posterior arches over here. The dens that's listed over here is actually part of the C2 vertebrae. So if you look at the dens is part of the C2 or axis that sticks out, right? That sticks out. And what happens is the dens is held in place by this transverse ligament over here. And the dens, because it sticks out into the opening of the atlas, allows you to actually move your head from side to side. So when you turn your head from side to side, your head doesn't fall off your vertebrae column, because the dens and the transverse ligament is holding it in place. As we move on down the vertebral column, we get to the thoracic vertebrae. So what you can see here is that the body of the thoracic vertebrae is larger than those of the cervical vertebrae. The spinous process over here is longer and projects downwards, right? So this is the one that you can typically feel in your back or a friend's back. The superior articular process over here on the top face towards the front, and the inferior processes face towards the back. But the most important part of the thoracic vertebrae is this. It attaches to the ribs. So the way that the thoracic vertebrae attach to the ribs, and we have 12 ribs, so we have 12 thoracic vertebrae, right? So rib 1 will attach to thoracic vertebrae 1, rib 2 will attach to thoracic vertebrae 2, and so on and so forth until you get all the way down to the last pair of ribs. So what happens is that the ribs articulate with the thoracic vertebrae at two different locations, the costal facets as well as the articular facets. So you've got the articular facets over here, and then you've got the costal facets over here. And again, we're going to look at that a little bit later as we move on to a discussion of the thoracic cage after we go through the last set of vertebrae, which is the lumbar vertebrae, the sacrum, and the coccyx. First one is the lumbar vertebrae. So lumbar vertebrae, the body is huge compared to the body of the thoracic and the cervical vertebrae. The transverse process that you can see here are short. The spinous process is also short and blunt. And then what happens is the articular process is facing backward, and this helps to the lumbar vertebrae to support the greatest amount of body weight, and it helps to provide stability, right? That's why the body is large compared to that of the thoracic and the cervical vertebrae. Underneath, posterior to the lumbar vertebrae, right over here, we've got the sacrum. So the sacrum is 5 vertebrae that will fuse as you hit the age of 20 years old into a triangular shaped bone, right? And you can see here it's wider at the top, narrower down below, right? You've got these holes. So foramina sounds like foramen. Foramen means hole. Foramina means small holes. That allows the spinal nerve to exit the spinal cord and travel to the various parts of the body that it provides nerve signals to. And then down the bottom, right over here, you've got the coccyx or the tailbone. Again, it's 4 small vertebrae that are fused together. It doesn't bear weight. Sometimes it's called a vestigial organ. The next part of the axial skeleton is the thoracic cage or the rib cage. So what you have over here is that it consists of the 12 pairs of ribs, their costal cartilage that help to connect them to the sternum as well as the sternum. So you can see here, this is the sternum right here. It's your breastbone. And you can see here that the sternum is can be divided into 3 main areas. The manubrium, which is the superior or top part, and you can see it's wider. The body, which occupies most of the sternum, right? It's long, it's the center part. And then the sword tip, as I like to call it, which is called the xiphoid process, and that's right down the inferior portion of the sternum. Costal cartilage connect the ribs to the sternum either directly or indirectly, and then you've got the ribs, right? In terms of the ribs, what you can see here is that there's 12 pairs, and as I said, they match up with the 12 thoracic vertebrae. When we go to the ribs, what you can see here is that there are 4 parts of a typical rib. So this is the side, this is the medial, the ventral is also the anterior portion, and then the posterior portion is also referred to as the dorsal. So at the anterior end, it connects up with the sternum, the breastbone. At the posterior end, it connects up with the thoracic vertebrae. So what you can see here is the head of the rib is right over here. It connects up with the is the posterior end of a typical rib, connects up with the vertebral body of the thoracic vertebrae, and then you've got the neck, which is right over here, right? It's to the side of the head of the rib. And it also connects up with the facet on the transverse process of the same numbered vertebrae. And then you've got the body of the rib, or the shaft of the rib, indicated here in 3. And that's most of the rest of the rib contains the angle of the rib. So it curves. This is where your rib curves around your side. And then the ventral portion of the rib articulates either directly or indirectly with the sternum. In terms of classification of the ribs, it really depends on how it's connected with the costal cartilage and the sternum. So sometimes rib pairs 1 to 7 is called the true ribs because it connects up to both the vertebrae and the sternum, right? So the costal cartilage in the front connects directly to the sternum. So that rib pairs 1 to 7. Rib pairs 8 to 12 are called false rib because they don't attach directly to the sternum. In fact, rib pairs 8 to 10 attaches to the cartilage to the next higher rib, so they kind of join together before they attach to the sternum, and the rib pairs 11 and 12 don't actually connect up to the sternum at all. You can see here that's rib pair 12 here, and 11, they just end at the back, right? So they terminate within the musculature of the lateral of the side of your abdominal wall. And then the last slide here is just a little bit to do with the formation of the axial skeleton during the embryonic stage. And what we see here is that the axial skeleton uses both endochondral as well as intramembranous ossification. So you can see here you've got them diagram over here. So this would be endochondral ossification, and then the diagram on the bottom left would be the intramembranous ossification. As infants, what happens is these are infant skulls. And what you can see here is that you have these fontanelles, which are also referred to as soft spots. And so these are portions in the skull where there's no bone, right? And what happens is the absence of bone at these fontanelles actually allow for the skull to actually grow rapidly. The other thing that you note over here is that the bones are not fused. So if you look at the frontal bone, you've got 2 frontal bone, and there's no, like, it's not connected at all, right? It's just it's separated. There's no suture over here, so it helps the skull to actually grow really quickly. Because if you look at it, when the baby's born, the cranium forms about it's a very small proportion of the cranium in terms of the adult cranium. So head at birth is a quarter of the total height versus an eighth of the total body height at maturity. And so what happens is as the baby grows, then the sutures will form as the brain stops growing. And and then you've got the appearance. You can see as a baby, there's no teeth over here, and the teeth then appear as over time as baby teeth or deciduous teeth, and that's later replaced by permanent teeth. So I hope this isn't too long, and I hope you've enjoyed it.